Hello and thank you for joining us on Health 247 on Rapid TV, a program that brings your way health insights, expert advice and empowering stories. In this edition, join us as we delve into the impact of female genital mutilation on reproductive health in Nigeria. I am Josephine Bitrus. Thanks for staying tuned. More than 200 million girls and women alive today have undergone female genital mutilation (FGM) in 30 countries in Africa, the Middle East and Asia where FGM is practiced. According to a 2018 Nigeria Demographic and Health Survey report, about 20% of women and girls aged 15 to 49 have undergone female genital mutilation (FGM), with the practice more prevalent in certain regions, including Southeast and Southwest. Health 247 delves into the impact of female genital mutilation on reproductive health in Nigeria. Female genital mutilation (FGM) refers to procedures involving partial or total removal of external female genitalia or injury to genital organs without medical reasons. It is a harmful practice often driven by cultural or social factors. This practice offers no health benefit to girls and women and can lead to severe consequences, including heavy bleeding, urinary problems, cysts, menstrual difficulties, infections, childbirth complications, and an increased risk of newborn mortality. Female genital mutilation is internationally recognized as a human rights violation, perpetuating deep-seated inequality and extreme discrimination against girls and women. Typically performed on minors, it infringes on children's rights and breaches fundamental human rights, including the right to health, security, and bodily integrity. It also constitutes torture and cruel treatment and can lead to loss of life.
There's no medical need for it. It's part of culture, it's part of traditions, and many reasons tie up towards that. There are different forms of FGM that is practiced around the world. Nigeria happens to be one of the areas where it's quite prevalent, not because it's unique to Nigeria, it's actually quite global, but because we have a very high population that is affected by it. The estimates a few years back, because the data is not very up to date, is that we have about 19 million women who have experienced female genital mutilation. And this is a fact that you find either children, babies, being cut, or women between the ages of 15 and 49. When you look at women between the ages of 15 and 49 years old, we actually have about 20% of them who have experienced female genital mutilation. And when you look at the whole population of women and girls who have experienced this, it comes to about 19 million women and girls. The tragedy of it is that many people still believe that it's relevant. There's been surveys done with men and boys about what they think about it. Some of those who know about it, there's a higher percentage is growing, about 60 something percent who believe that it's not right. With women, about almost 80%, 70 something percent, I also agree that it's not right. But it continues to happen. It's hidden under the different guises of traditional processes. For instance, it can be done on a baby in the name of naming ceremony. It can be done on a girl in the name of puberty rites. And, there could be festivals around it that hides the nature of what exactly it is. I think I don't want to say the good thing, but it is a good thing is that it is reducing. But it's like a yo-yo. It reduces now, it goes up again, it goes down, it goes up, and so on. And so there needs to be a concerted attention focused on what is female genital mutilation and how can we stop it altogether.
In some settings, evidence suggests health workers are increasingly performing female genital mutilation FGM driven by the belief that medicalization makes the procedure safer. This trend is concerning as it may legitimize and perpetuate the practice rather than promoting its abandonment.
This is one of the things that education has brought in. The question is, why are you doing this procedure? Why are you carrying out this surgery? There's absolutely no health benefit. There's absolutely no health reason behind it. The only reason is to control the body of a girl or a woman. And so, why do you go and interfere with the body of somebody who has nothing to do? Yes, you may undertake the an FGM procedure in a medical environment, so you avoid cutting neighboring tissues because you have an expert who is doing it. You may avoid scarring because maybe you take care of it and so on. But do you avoid the trauma that comes with it? Do you avoid the sexual dysfunction that also comes with that procedure as well? So it's not about whether you do it in a healthy environment, in a safe environment. It's about, why are you doing it? And that is the question. That culture may be a culture, may be a tradition, but is it still useful for us? Was it ever even useful for the people who do it? That's the question that families need to answer.
Nigeria has one of the highest female genital mutilation prevalence rates globally. The 2018 Nigeria Demographic and Health Survey reports that about 20% of women aged 15 to 49 have undergone FGM. The practice is more prevalent in certain regions, including Southeast and Southwest. Female genital mutilation FGM poses a substantial public health risk in Nigeria, having profound and lasting impacts on women's reproductive health, overall well being, and fundamental human rights.
So, in the immediate and short term, the complications could involve things like bleeding, severe bleeding, and shock from pain and blood loss. There could also be infection due to unsterile instruments, especially when it's done as part of a cultural rite and you have a pack of a group of people that are being processed in the same period. Or even the tools that are being used, because they have specialized, the professionals who do it have specialized tools that they use. So there could be infection even from these tools and poor hygiene around the treatment of the tools. There's also urinary retention and sometimes difficulty in urinating, especially where you look at the suturing, the sewing that they do and leave just a little bit of hole. And then there's injury to nearby tissues as well, especially when you find that this is not done under any anesthesia and the person is in pain, the person is being held down, and the person is writhing and struggling. So the danger can easily arise from cutting of neighboring tissues. And of course, in severe cases, death has been registered as a result of complications from such. In the long term, there's chronic pelvic pain as a result of painful menstruation and related matters. There's a recurrent urinary tract infection as well, and this could also lead to other more serious medical issues. There's complications in childbirth. That's the one people hear most about. Um, During childbirth, there could be prolonged labor, tears, bleeding, and so on. Infertility could also be a result of that because of scarring and infection that happens. Sexual dysfunction is also one of the issues. Remember that they want to maintain the purity of the girl and want to make sure that the girl doesn't engage in sexual issues. So there could be sexual dysfunction that happens as well. There could be also VVF as a result of that and stillbirth. And the psychological trauma is also one thing. And especially the psychological trauma is even more serious because who do you discuss it with? It's a very private matter. A lot of people don't discuss it. There's nowhere to go to share the trauma that you experience because of that. So there are a lot of long-term health consequences, and you find that migrant communities, especially in Western countries, for instance, if a group of Nigerians who practice in their community migrate to a Western country, they have a way of also continuing the practice below the radar, even though it's illegal and frowned upon. And maybe this is the point to also say that it is currently illegal in Nigeria through the Violence Against Persons Prohibitions Act, which has been domesticated by almost all the states except one, I believe, which is Kano State. And there was also a bid to repeal the Violence Against Persons Prohibition Act and replace it with something that's more encompassing and covering a whole range of other violence issues. But my fear is once you bring something into the open, you may live with less than what you used to have because those who are against it will have an opportunity to affect it.
Effective strategies for preventing FGM and supporting survivors in Nigeria include community based education and awareness initiatives such as community dialogues, advocacy efforts, and sensitization campaigns. Additionally, providing comprehensive support services, including medical, psychological, and emotional support to survivors, is crucial. These approaches can help drive change and improve the lives of those affected by FGM.
The law actually prohibits FGM and it ensures that anybody who does it or causes it to be done is guilty. The problem we have is how effective is our implementation of our laws. That's the issue. And you find, especially where issues are in the private domain, families compound crimes. And so they'll say, no, we don't want police case. Oh, no, we don't want any issue. And usually the victim, I'll call the person a victim at this point. The victim is someone who is not empowered, is young, is under guidance of the parent or guidance or whoever it is. So that person on their own is not able to rise up and resist. But there's progress in the law, in the legal system that helps. The issue of local standing, which was a concept in those days where if you take a case to court, you must show how you are affected. But that issue, I think the court system, the jurisprudence has developed, and that is no longer an issue, and so that is actually very useful. And there are bodies, agencies of government and non-governmental organizations that have also risen up to the task of making sure they are not only creating awareness against female genital mutilation, but they are also doing a lot of support activities. Um, One of the things that we lack are shelters. Because you find if a girl is empowered enough to resist, she may need to be taken away from that environment for some time for her safety. But we lack shelters to be able to house such girls who want to leave that environment. And so it's quite a challenge to be able to support people who want to do that. The implementation of the law, as I mentioned, is another matter. We have laws and we just put them on the shelves and we pat ourselves on the back that we have these laws, and it moves on. So we need to also strengthen our implementation of the laws as it is. The community, our culture and traditions are upheld by our communities, upheld by our traditional institutions, upheld by mothers, upheld by fathers, and so on. You think that, okay, this is a practice where about 80% of women who know about it think it's wrong. And you wonder, so why can't they stop it? Why can't they say no? Because they are also subjected to the culture and practice, and they are not able to break out of it. So it will need the work of communities as a whole and the support of traditional rulers for dialogues to happen, for people to decide, no, we don't want this anymore. Many communities have made progress. For instance, if you look at funeral rites in many communities, you find that traditional institutions have put in place policies. They will say, oh, if you are a Christian, you don't need to kill a goat, and things like that. So, but in some of these practices, whether you are a Christian or not, the culture still expects you to do them. So, how can those institutions put in place those kind of freedoms for people, and also ensure that even without FGM, a young man should be happy to marry a girl who has not gone through that process and know that there's nothing wrong with that girl. All is well. It's even a better lifestyle, well-being for both the girl and his family and their children in the future. So communities are very, very important in communicating, in advocating, in communicating, and in transforming the change that we require. Then, of course, there's the health system. You can imagine a teenager going to a health center to say, look, they're about to exercise FGM on me and I don't want it. What's likely to happen? If it's the health center in that community, the staff may be people who also believe in that custom and tradition, and they will just maybe encourage her, look, it's good, everybody did it, so don't be afraid, it will be all right, and so on. So health personnel need to rise above some of these practices and be able to say, look, my first duty is to my client, to my patient, and to be able to bring about the kind of service that is required by them. Then, of course, there's issue of empowerment, girls' education. Many times, people become victims of practices because they don't know that the law supports them. Because not everybody is afraid, not everybody is submissive. So when some people know that, oh, this law says no, FGM cannot be practiced on me, some self-aware young women, young girls will be able to stand up for their rights and say, no, 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 I'm not doing it. If you insist on doing it, I'm going to report you, and things like that. Or just generally refuse to be subjected to it as well.
In Nigeria, FGM is entrenched in traditional and cultural norms, posing significant challenges to eradication efforts. However, this also presents opportunities for meaningful change and progress.
You find that the key challenges we have is that we are a community, a society that's deeply entrenched in our culture and norms. I'm sorry I keep going back to culture and norms and so on. It doesn't matter where you are from, It doesn't matter where you have lived all your life. It doesn't matter whether you know where your parents came from or not. That culture seems to continue to follow Nigerians wherever they are, and there's an inability to change the culture. Culture is supposed to be something that's dynamic, that changes with time and so on, but the time is very slow for many cultures. So there must be active action to say, this culture, we are stopping it now, and it will stop if that happens. So we need to be able to do that. That's one of the biggest challenges that we have. And this is more critical as the world becomes more internally focused, more national. Everybody is looking for self-identity and so on. And so culture is one of the things that we hold on to for self-identity, self-preservation, and to recognize ourselves as a unique group of people. And unfortunately, some of the practices under this culture are some of the things that really affect women and girls negatively. And one key one is the FGM practice. Then as you mentioned, the medicalization of FGM is a very, very big challenge as well. Because when the advocacy started, it was looking at all the impact on health and reproductive health of the girl and of the woman. And so the medical process has been introduced to say, oh, we are now doing it in clinical environments, professionals are doing it, so there's no danger of that again. So we now have to actually go to the root of the matter and see, why is this practice happening? And as we go into that root of the matter, the strategies we use to respond to the challenge, we have to be related to the reason why that is happening. And the opportunities are the amount of work that you have, people like Ministries of Women Affairs, NAPTIP, to an extent. You have NGOs, especially NGOs, are doing in terms of creating awareness and so on. But we need to move it further. We need to move it into the legal field. We need to show that the sanctions are there and that the sanctions actually work. And we need those stories to go out so that it prohibits some people who are prone to doing it just because it is, to be able to stand up and say, no, I won't do it. I don't want to go to prison. I don't want to pay a fine, and so on and so forth. In essence, I think those are the integrated health service system that is ongoing may help. I say may because our primary health system and all the challenges that we have, not even primary, even secondary health system, tertiary, all the challenges that we have in those fields as well. Youth engagement, and particularly male youth engagement, I think is also very critical. If families find that, oh, their uncircumcised girls are not finding husbands, and young men are discussing among themselves and say, no, I must marry a girl who's circumcised, it will drive the culture forward. It will drive continuation of that process. So they hold the key, young men do hold the key to being able to influence the transformation we need to happen in our customs to stop FGM as well.
Female genital mutilation remains a complex issue in Nigeria, requiring targeted interventions and awareness campaigns to address regional disparities and social cultural factors. Healthcare providers and policymakers should collaborate with community leaders, NGOs, and other stakeholders to develop effective strategies. Both parties should work together to collect and analyze data on FGM prevalence and health consequences to inform policy and programming. Healthcare providers and policymakers should jointly advocate for FGM prevention and care, raising awareness about the issue and promoting policy change. Through collaborative efforts, healthcare providers and policymakers can mitigate the health consequences of FGM and improve survivors' lives. And that wraps up this week's edition of Health 247. Don't miss next week's episode, same time, same channel, for more health insights and updates. See you then.